Mechanical thrombectomy helps remove clots and debulk the clot, improve flow in the lungs. We've seen that. We've seen significant improvement with pulmonary pressure, with flow in the lungs, with patient symptoms. That happens. If you go in and do a CT scan next day or the day after, and we have studies looking at this, you are going to see that you have not removed a lot of the clots in there. It is interesting to see the report actually of the radiologist afterwards when it says slight improvement in clot burden. It's very interesting because we know the patients improve, but we know that we're always leaving clots behind in the smaller vessels. That does not mean the mechanical thrombectomy is not working. It means it's working in the intended result, which is remove the most proximal clots to help flow in the lungs in general, reduce the burden on the right ventricle. But we almost always leave clots and obstructed arteries behind in the more distal vessels. The question is, how do you get those resolved? If you look at the study that Dr. Bashir did, that Dr. Bashir published, the rescue trial of the pharmacomechanical thrombectomy with the BEC device, and you look at the CT scan, you look at the result of the outcome when it comes to clot resolution, when it comes to obstruction index down in the distal vessels, you realize that you have a significant improvement there. It's never 100%. It's not even 75%. But when you compare it to the numbers that we got with other forms of thrombectomies, you realize that you have a significant improvement just compared to historical data from mechanical thrombectomy. So we know that doing something else other than just removing the proximal clots can help reduce the obstruction downstream. And that's an important concept because if you don't have good flow downstream in the smaller vessels, you're not going to have a significant improvement in the RV function. You're going to still have some dysfunction down the road in terms of obstruction later on, maybe post-PE syndrome and things like that that we try to avoid.